healthcare development in Nigeria is going to depend a great deal on technology and innovation, which explains why we're paying a great deal of attention to the remarkable innovations of our burgeoning tech sector. Many young people are solving huge problems in medicine and in other aspects in other aspects of our lives with a great deal of creativity. In the medical sector, just a few days ago, I was talking about LifeBank, which is a company founded by a young Nigerian, Temi Giwa, and Flying Doctors, another company founded by a young Nigerian, Ola Orekunrin. These two, both LifeBank and Flying Doctors, are startups using technology innovation to fill critical gaps in our healthcare industry. LifeBank works on blood shortage problems in hospitals, and they save lives by speeding up blood donations and delivery to hospitals in Lagos. Their LifeBank application, their app, connects donors and hospitals, and they ensure delivery of blood within 55 minutes. In the case of Ola Orekunrin's Flying Doctors, this is the first air-operated emergency medical service in West Africa. Her company provides air ambulance from a pool of 20 aircrafts and highly trained medical personnel for emergency evacuations. Recently, we ran a mechathon from our Northeast Humanitarian Technology Hub. Now, just to explain, the Northeast Humanitarian Technology Hub is one of the technology hubs that we're developing as a government. In the particular case of the Northeast Hub, it is to provide innovation in solving humanitarian problems that have arisen in the Northeast. And we've had hundreds of innovations proposing highly innovative solutions to public health problems. These are from very young Nigerians who are proposing some of these very groundbreaking public health solutions. We intend to engage even more robustly with our technology community on an ongoing basis because we believe that a lot of the answers to some of our public health problems will lie with the creativity of these young men and women. Our social investment program through our homegrown school feeding scheme is investing heavily in improving health outcomes for primary school children by tackling stunting and malnutrition. We're working closely with the Partnership for Child Development, PCD, a research body based at London's Imperial College, and with a track record of supporting interventions that translate into healthier and better educated children. The school feeding program currently serves about 7.6 million school children across 22 states and will continue to sign up more states practically every month. Although the school feeding program, as I said, does not cover all 36 states yet, and we're just in 22 states, it is very clear that this is a crucial program, especially in addressing the malnutrition needs of a large number of young Nigerians, of young children who are in deprived areas or who come from poor families. And through the Empower Youth Employment Scheme, we're expanding Nigeria's cadre of health extension workers who will make a positive difference in hundreds of communities across the country. We've engaged several thousands of them. I think we have about 40,000 of them who are engaged directly by government as part of our Empower program, and they're working as health extension workers in several local governments in Nigeria today. As I close, let me use this opportunity to express the deep concern of government about some of the negative impact that strikes in our public health service have. While agitations for better conditions of service by healthcare professionals are and will continue to be necessary and legitimate expressions, we also wish that medical personnel should take on some responsibility for showing greater understanding in your dealings, especially with government, as we jointly work together towards solving the several problems and tensions in the health sector. Many of these problems are problems that predate many of us in so many ways. Predate your administration, predate our administration. But there are problems that must be solved by sitting around a table and trying to resolve them. Where those problems, where the resolution results in the loss of lives of so many Nigerians, then we must take a second look at how to approach it. On our part, we will continue to listen to you and to discuss solutions that are agreeable to all stakeholders. We've constituted an interministerial committee to examine all previous reports, documents, policy instruments and laws, including the Yayale Ahmed Committee report. With the goal of engendering cordial working relationships among all health personnel and between all of you and the federal government. I commend the outgoing national officers who have led the affairs of the association in the last 2 years, and a very impressive tenure devoid of acrimony and instability. I also must wish you very successful rancor-free proceedings as you elect new officers. I'm always impressed by the excellent example of orderly elections and transition displayed by the Nigerian Medical Association. Please keep it up. But I must not fail to convey to you the sentiments of your compatriots of the legal profession, my profession. On this trend, your undisputed elections deprive us of very lucrative briefs, which we would have had were you to prefer the route of litigation. While not encouraging that course of conduct, I must remind you that whenever people pray on the 31st of December of every year, that may we not see litigations, some people do not say amen. It is now my singular privilege and honor to declare the 58th Annual Delegates Meeting and Scientific Conference of the Nigerian Medical Association, Abuja 2018, open. Thank you.
By the special guest of honor, and of course it's going to be followed by the unveiling of the Nigerian Medical Association 2017-2021 strategic plan, and of course we'll be seeing that in a short bit. A bit of light-hearted sparring there between the Vice President and the President of the Senate, and of course we've heard that the 1% of the budget for healthcare this year is going to be seen in the next few days. And the theme for this year also brought into focus human capital development, and of course in a like manner, the way the Vice President is known to do, shedding light on people doing amazing work in healthcare in Nigeria, and of course highlighting the scandalously low funding in healthcare in our country, and a robust health insurance scheme with private sector partnership and investment, he said, will move the required reform in the health sector in Nigeria, looking at a focus on primary healthcare and how that can help move the health sector from where it is to where it ought to be. It has been a very interesting event, the annual general conference, the 58th annual general conference and delegates meeting of the Nigerian Medical Association, and of course that unveiling of the NMA 2017-2021 strategic plan is underway.
Unveil. Please, if you are not in that category, may you just move away so that we can have enough space for those who need to take pictures for this unveiling.
The chairman of this occasion, the Senate President, distinguished guests, it is now my very special pleasure and privilege to unveil the Nigerian Medical Association's strategic plan 2017 to 2021 for the benefit of the medical profession and the people of Nigeria, and to the glory of God.
There in full view, the 2017 2017-2021 strategic plan of the Nigerian Medical Association. It is hoped that this strategic plan will take the medical profession and, of course, healthcare in Nigeria to greater heights in addressing some of the major issues such as medical tourism and some of the primary healthcare problems that we face in the country. The 2017-2021 strategic plan of the Nigerian Medical Association.
The Vice President on his way out. When we are done with the pictures, we will take the national anthem that will usher the Vice President. Your Excellencies, the national anthem. We must appreciate the Vice President for his time as he leaves us. We'll also inform you that we will be taking the keynote speech immediately afterwards. Our special guest will see the Vice President as he leaves. The other special guests will be joining us here back on their seats at the in front here as we prepare to take the keynote speech or keynote lecture for today.
Getting ready for the keynote speech, the lecture, the guest lecture that we're going to be listening to today. Former Minister of Health, Professor Itayo Lambo, will be delivering that shortly.
Well, we'll allow the police band to give us a little music while we get set for the lecture. Thank you.
Made his way out of the auditorium. We see everybody getting ready for this guest lecture that will be coming up shortly by the former Minister of Health, and he's going to be shedding light on a lot of things. The keynote speaker for today, Professor Itayo Lambo. The Nigerian Medical Association having their 58th annual general conference and delegates meeting, and a lot has happened in the few hours that we have been here. The unveiling of the Nigerian Medical Association strategic plan just happened. The budget for health has also been in focus, and of course we heard there from the President of the Senate, 1% of the budget will be going into health, and of course that is some good news for the health sector, because one of the major problems riddling the health sector has been the scandalously low amount of money that is being budgeted for health in the country. Of course, that bit of light-hearted sparring that happened earlier between the Vice President and the Senate President. I'm talking about how many people are in the President's cabinet. Well, 7 lawyers and 4 doctors, they said. But just when the lawyers thought they could take over, they found that the Senate President is a doctor, which is something that many people do not know. He may not be practicing right now, but of course that is a fact. The theme for this year's AGC-ADM is quality healthcare delivery. an indicator of good governance. And you heard the Senate President speaking earlier, talking about the fact that Nigerians like to see ribbons cut and buildings being put up. And while that may be good for votes, but it will be important to improve healthcare delivery, primary healthcare delivery in the country, and that is one of the major focuses of today's program. It's the opening ceremony for the Nigerian Medical Association 58th AGC ADM. That is the annual general conference and delegates meeting. Sub-themes for this year: budgeting for health in resource-poor settings, the Nigerian experience; reversing medical tourism through efficient